Bismillahirrahmanirrahim. Assalamu alaikum. This is Sayyida Ramla Zaidi, roll number PP16502229. And today in my presentation, I will be discussing about the rational and irrational uses of drug kanamycin. So let's start. Kanamycin is an aminoglycoside bactericidal antibiotic, and it is mostly available in intravenous and intramuscular forms. It is isolated from the bacterium Streptomyces kanamyceticus, and its most commonly used form is kanamycin sulfate. Kanamycin injection is used to treat serious bacterial infections in different parts of the body. It's also used to treat tuberculosis. It is active against aerobic gram-negative bacteria, and this medicine is used for short-term use only, usually 7 to 10 days. Irrational uses. This medicine should not be given for colds, flu, or other virus infections because overuse of kanamycin has led to many wild bacteria-possessing resistance plasmids. Now, dosage. It is mostly available in injectable forms. For adults, in acute infection, 1 gram IM daily in 2 to 4 divided doses for maximum 6 days are preferred. For children, 15 milligram per kg IM daily in 2 to 4 divided doses for maximum 6 days are given. Administration. It is administered by deep IM injections into the upper outer quadrant of the gluteal muscles or by IV infusions over 30 to 60 minutes at a concentration of 2.5 to 5 milligram per ml. It is also administered by intraperitoneal instillation and irrigation in some cases. Now, drug interactions. If we administer kanamycin along with these mentioned drugs, there will be changes in the pharmacokinetics of either of these drugs. So let's discuss one by one. Abacavir. Kanamycin may decrease the excretion rate of abacavir, which could result in a high serum level. Aceclofenic may decrease the excretion rate of kanamycin, which could result in a high serum levels. As you know, Comerol, the risk or severity of bleeding can be increased when kanamycin is combined with this drug. Acetaminophen, which is the most usually used drug, kanamycin may decrease its excretion rate and which could result in a higher serum levels. Acetylcholine, the therapeutic efficacy of acetylcholine can be decreased when used in combination with kanamycin. So we must avoid these combinations, and therefore the toxicity may also reduced. Side effects associated with kanamycin are ringing in the ears or loss of hearing, toxicity to kidneys, nausea and vomiting, diarrhea, blurred vision, headache. Adverse effects may be ototoxicity, nephrotoxicity, and anorexia. Now, there are alternatives of kanamycin, which are neomycin and paromycin, because they all belong to the same family of Streptomyces. That is the reason they have same chemical and physical properties and can be used alternatively. Now here I have enlisted some alternate brands of kanamycin in terms of pharmacoeconomics. The first category is of the low price brands. Here we have Sin from Sedon, and the injection 1 gram, 1 vial, the retail price is 90 rupees only. And for 500 milligram injection in 1 vial, the retail price is 60 rupees. Second brand is Negacin for Emros, and the injection of 1 gram, retail price is 88 rupees, and 500 milligram injection in 1 vial, the retail price is 65 rupees only. The high price category, here we have a brand of Kanamycin from Continental Pharma. The 1 gram injection in 1 vial retail price is 149.51 rupees, and 500 milligram injection, the retail price is 115 rupees. The another brand is Canon from Polyfine, 1 gram injection in 1 ampule, the retail price is 110 rupees. Now here we have a case study of a patient. So let's see what is the effect of the kanamycin and what is the most possible treatment of this patient. CJ, a 45-year-old male, prison inmate with AIDS, presents with fever, cough, and occasional night sweats. A tuberculin purified protein derivative skin test is negative, where CJ is assumed to be energetic based on his response to other skin test antigens. Two acid-fast bacilli sputum smears are also negative. Chest radiograph reveals hilar adenopathy with a questionable right middle lobe localized infiltrate. No cavity lesions are seen. His antiretroviral medications include abacavir, lamivudine, and efavirenz. CJ is more likely suffering from TB, then what should be the preferred treatment? I have prepared SOAP notes for this case study. The SOAP stands for Subjective, Objective, Assessment, and Plan. Let's discuss one by one. Subjective. Age of my patient is 45 years old. Gender is male. Chief complaint is AIDS and right middle lobe infiltrate with hilar adenopathy, consistent with TB. The associated symptoms involve fever, cough, and night sweats, and the current medications are abacavir, lamivudine, and efavirenz. Objective. Tuberculin purified protein derivative skin test is negative. Two acid-fast bacilli AFB sputum smears are also negative. Now assessments. CJ presents with fever, cough, night sweats, and a right middle lobe infiltrate with hilar adenopathy consistent with TB. And his HIV status in combination with his incarceration increases the probability that the patient is suffering from Mycobacterium tuberculosis infection. Now, what will be the plan for the treatment of CJ's condition? It includes kanamycin in the dose of 75 mg per 2 ml IV per day, pyrazinamide 20 mg per kg per day orally, ethambutol 15 mg per kg per day orally, and levofloxacin 500 mg orally or IV daily. All this material is taken from Applied Therapeutics 9th edition by Koda Campbell, PharmaGuide, Medscape app, and Wikipedia. Thank you so much.